morning. Welcome to Joy in Our Town. I'm your host, Laureen Tanaka. We are here with Lisa Kimura, and she is the Executive Director with Healthy Mothers, Healthy Babies Coalition of Hawaii. Thank you so much for being here.
Thank you for having me.
Now, breastfeeding gives children a good, healthy start in life, doesn't it?
It sure does.
Tell us a little bit about why breastfeeding is so important.
There's really no substitute for mother's milk. It's absolutely the easiest possible thing you can do to give your child a healthy start in life.
No mixing.
Yeah, I mean, when you're a busy parent, especially in the early days, I mean, there is no way you want to get up and make bottles and wash bottles and clean.
True.
It's just another thing to add to the list. But when you get down to why it's so important for your child and for yourself as a mother, the lifelong health benefits cannot be beat.
Wow, so what does that mean? I mean, mothers are giving their children vitamins and nutrients. What do these vitamins and nutrients do for the child? What are the benefits of that?
First of all, I mean, when you're talking about healthy growth and development, starting at the molecular level, you know, the healthy fat in breast milk contributes to brain growth and development at an amazing pace that just really cannot be duplicated by anything on earth. From the beginning, you know, the first thing that a mom can do is just, you know, to get started and give baby colostrum from day one. But when they've compared the difference between formula-fed babies versus breastfed babies, the risk of everything from ear infections, gastrointestinal illnesses, even leukemia, diabetes, obesity, all of these things are much, much higher in babies that are not breastfed.
So from the time they are newborn, all those benefits kick in, and it starts building their immunities or giving them the strength that they need.
It does, and what's so amazing about breast milk is that it continues to change as your baby grows and develops. So the composition of the milk continues to evolve based on your baby's individual needs.
Oh, I didn't know that.
It's amazing.
Our bodies are amazing.
It's amazing, and even what's really great too is, say, you know, mom gets sick with a cold or flu or whatever, the greatest part about it is the antibodies that mom is producing to fight off that cold or flu or whatever is getting passed through the milk. So you're basically giving baby a vaccine against whatever you have right now.
Oh, so you don't have to stop breastfeeding when you are sick. It's actually keep going. Your body knows what it's doing.
Yes, and that is a really common question people have is, should I stop?
Right, thinking that we're going to give the baby the cold, right?
And in fact, it's the exact opposite. We're giving them an added protection.
Wow. Now, how long has Healthy Mothers, Healthy Babies been around?
Nationally, it started a little over 30 years ago, and in Hawaii, the Coalition of Hawaii started a little over 20 years ago.
That's good.
Yeah, so we've been around. We advocate for women before, during, and after pregnancy, and we really try to offer help, support, programs, and advocacy every step of the way.
Nice. So if anybody has other questions, maybe that may not be covered, they can contact you at your website.
Yeah, Yep, our website. And we also have a Mother's Care line, which is open to moms or dads or grandparents.
Right.
Monday through Friday, 9 to 5. And all the information's on our website. But they can call and ask questions, everything from car seat safety, finding insurance, prenatal classes, everything.
Oh, okay. Okay. So what are some common questions that people ask?
You know, some of the most common questions people have, I mean, I'll be honest, breastfeeding really is one of the biggest ones.
Is it? Well, it's a topic of conversation.
It is, and you know, there's so much about it that it seems like a natural, instinctual thing, and it is, but there are so many little road, you know, speed bumps that you hit along the way that just might, you know, trip you up, give you questions, and just knowing where to get help and support is vitally important. Okay,
so what besides breastfeeding, what is speaking of breastfeeding, what is a common question that people will ask?
Yeah, you know, aside, a big one is, the biggest one I would say definitely is, am I making enough milk, or is something affecting my supply, or how do I know? And the truth is, it is a supply and demand issue constantly. So as much as your baby is demanding from you, your body knows what to produce.
Oh, okay.
And when your baby goes through a growth spurt, they might want to feed every hour on the hour. And you know, some people take that as, oh my gosh, you know, baby's always hungry. Well, the reality is they might be really hungry, but your body's like, hey, let's step it up, let's make some more, and you do.
Okay, now is there a time limit as to how long a child should continue to breastfeed with their mom?
The most ideal recommendation that the World Health Organization recommends as a global standard is nothing but breast milk for 6 months. So that means no formula, no food, no water, supplementing.
Not even water?
Not even water, because milk gives them all the hydration that they need.
Okay.
And then continuing at least through a year, if not 2 years or more.
Oh, okay, okay.
And what's interesting is worldwide, the weaning age on average, you want to guess?
No, I don't. What is it?
4 years old.
See, and yet here in the United States, or in Hawaii as well, we think that by the time they're either ready to walk, then they should be done.
Yeah, and a lot of people, more research has shown really, we've gone back to basics ultimately, and we've really discovered through more research that it's developmentally appropriate and extremely beneficial to continue on. There's no need to start giving cow's milk when you're making your own body exactly made for your child.
Okay, so what if a mom says, for whatever reason, she's not able to produce the breast milk? There's that guilt now of thinking that, oh my gosh, I'm not giving my child that healthy start. How do you address that if they mention it?
Yeah, every mom wants to do their best for their baby, and HMHB applauds every mom for making the best choices they can. And if for whatever physical reasons they're unable to, or whatever reasons there might be, there are certainly other ways to support your child's healthy emotional and physical development. Giving formula is not the end of the world, but definitely if you can make the choice to do it and you physically can, then we're here to support that.
Now, breastfeeding is not just the nutritional health as far as health for the baby, but it's also a bonding.
It sure is.
Right? It has a bonding effect on.
Yeah, your body releases oxytocins, which are the kind of happy hormones when you're breastfeeding.
Love those.
Yeah. So as you're, breastfeeding and you're looking into your baby's eyes and you have that kind of bonding relationship that just, can't be replicated, it's an amazing feeling. Not to say that dad, grandma, anybody can't help too, because you can pump and have baby take a bottle. And that's totally fine too. So that's definitely an option. And what's great now is that under the Affordable Care Act, health insurance, private commercial health insurance is required to provide a breast pump. So now,
I bet that's that's something a lot of people did not know.
Yeah, that's something new. And if you don't know, that only started this past year. So that's a really important, big step forward.
So that other family members can bond as well.
Exactly.
During the feeding times.
Yep. And going back to work is a really important one, and that's something that you got to plan ahead. So getting a quality pump and knowing how to use it and knowing how often to use it, that gets you started.
Wow, that's interesting. Now, you said that the parents can ask all kinds of questions when they call HMHB. What you said about child safety, the seats, child, car seats?
Yeah.
Is that a common question that people ask?
It is. People will want to know, for example, car seat installation. You can't leave the hospital without having a car seat properly installed in your car.
They will not give you the baby?
They won't let you go home. So that's, number one before you leave the hospital. Another common one people want to know is getting prenatal care, how to get started. And a lot of people will ask about obtaining health insurance. And fortunately in our state, we've expanded Medicaid coverage, so more people are financially able or can get tax credits to obtain health insurance for the first time if they're not qualified for Medicaid.
Okay, so you mentioned prenatal care. What are some things before baby is born that a mom should be aware of?
Number one thing, if mom is a smoker, is to stop smoking.
Because that will affect baby in uterus.
Yes, absolutely. And it's one of the most significant risk factors for causing preterm births, for causing a lot of problems with the unborn baby, and also continuing into the first year of life. They have a higher, an increased risk of respiratory infections, bronchitis, asthma, and so even just secondhand smoke, if there's other smokers in the home, or even third-hand smoke.
Yeah, today we're talking about third-hand smoke.
All of those things are risk factors, particularly for SIDS, sudden infant death syndrome.
Smoking is a risk factor for SIDS?
Significant risk factor, and a lot of people don't know that. Yeah,
I didn't know that at all. Wow.
So knowing the risks are important, and then getting help with stopping smoking and drinking, of course, as well, is very, very important for babies.
So once mom finds out she's pregnant, then if she can find a way to start stopping, if not go cold turkey, that would be the way to do it.
Absolutely. And
that would be motivation.
It sure is. I mean, anything you can do. I mean, I feel like once you're pregnant and once you have, a baby that is completely dependent on you, you want to change your lifestyle so that you can be as healthy as you can.
Sure, it's a big responsibility.
It's the hugest responsibility.
And you have 2 and 1 on the way.
Yeah. Third one is coming in September.
Wow, that is interesting.
Yeah.
Okay, so where does a mother, if say a mother has more questions about breastfeeding or any other safety issues about their children, can they call you, and you have people standing by? You said you have a hotline.
Yes.
They can just call you and ask questions right there?
Yep, they can.
Okay.
Yep, and we're trained.
Do they have to give out confidential information, like who they are, or can they just ask?
We do ask, where they're from, city and age, just for our records. Yep.
Right.
And But if they don't want to provide it, there's no requirement to do that. We're more there to help than anything else.
Now, does your coalition go out to the public, to the community to educate?
We do. We offer a safe sleep class, and that's to help expecting and brand new parents to learn how to help their baby sleep safely to prevent SIDS and other sudden unexpected infant deaths. So what we'll do is for low-income, high-risk families, we'll give them the education, and then they actually get to go home with a pack-and-play crib, so they have a safe place for baby.
Oh, okay. Yeah. So what do you teach as far as safe sleep? How is the baby supposed to be sleeping?
Babies should always be put to sleep on the back. They should never have pillows, blankets, anything
around their head.
Yeah. You know, you feel like they're these little, you know.
But you think that maybe they're not comfortable, I should put a pillow for them, but that could be very dangerous.
Very dangerous, yeah. Especially up until, the highest risk is up until about 4 to 6 months of age. At that point, they don't have the neck control or the muscles to be able to get themselves out of danger. So if they start to get, you know,
their breathing is constricted or blocked,
they don't have any way to physically move themselves out of the way. So important for people to know, loose blankets are very hazardous.
Yeah, you think you want to keep them warm and tuck them in, but they can have their little onesies that's all warm.
Yeah, exactly. Just put another layer on them. And the other thing is, too, people kind of tend to bundle babies because they're, you know, you want to bundle.
But you think that in the nursery, right, they're like so tight in that blanket that they're wrapped
and swaddling is okay as long as you properly know how to do it, and it's very, very tightly tucked. But the loose blankets and the thick quilted blankets are not so
those
safe.
Plush animals and toys, not a good idea in the crib.
But not. And then another interesting thing that a lot of people don't know is that bumper pads are actually not recommended either.
Oh, they're not?
And they do come, although in some states it's now been outlawed, but they come with the crib set.
They do.
And they look cute, they match your decor.
Well, people think so the baby doesn't bang his or her head on the railing, right?
Yeah, but the actual reality of it is that is less likely to cause injury than actual asphyxiation.
Because I guess their faces can get caught in between that too, or underneath it.
Exactly. And again, they can kind of, you know, especially when they're starting to roll, but they're moving. Can't get out of the way if they get trapped.
Wow, we could go on, and this is really interesting what your coalition is doing. Thank you very much.
Oh, you're welcome. We really enjoy what we do.
Oh, you're good at it, and the information is great. Now, going into our second half, parents should be aware of issues that affect families that are being discussed in the legislature today. Give us an update on what's happening now.
Well, one important law that passed last year that's very, very important for especially new families to know is that moms that are breastfeeding are now entitled to breaks to pump at work. So if they work for a company with 20 or more employees, they're entitled, you know, on the job to take a break to pump as often as they need to, and the employer needs to provide a clean, private place that's not a bathroom for them to pump. And it's really not as difficult as people might think. It's very, very simple, actually. As long as there's an electric outlet that they can plug in a pump and somewhere they can close themselves off, even if it's just a temporary screen that you put up, that's fine. That's okay. But it's just something to do for moms so that we can help them sustain that relationship. And studies have shown that employers that are amenable to moms and families are much more likely to retain those employees. And healthier moms have healthier babies, fewer sick days, you know, less lost productivity. So
well, a happy worker is a productive worker, right? So, I mean, if you're taking this stress and worry out of her, worrying about her children, and now she's going to feed the babies, then that's that much better for her there at work. And then she can probably focus more on the work because what she has to do is done.
Knowing your employer cares about you and your livelihood makes you happy to go to work. So.
Wow. Now, what about we hear some controversy about women breastfeeding in public. Where are we at on that?
Truly, what's important for women to know is that they are entitled by both federal law and state statute to breastfeed anytime, anywhere, and they're not required to wear any kind of nursing cover. That's really at her discretion, her comfort level. So if that's something that she feels more empowered to use to be able to nurse baby, that's great. That's good for her. But you know, a lot of people kind of overthink it, and they worry more about what other people are going to say or think, or if they're going. But the truth truth is, most people don't even notice that that's what you're doing.
But we also, I think we also forget that it's a very natural thing to do when between mom and the baby.
It is.
I mean, in other societies outside the U.S., it's probably much more forgiving than we are here, right?
Yes. We've tended to turn it into more of a controversy than it needs to be.
Offensive act, but it really isn't.
It's really not. We just need
when
to
you understand the benefits of breast milk.
Absolutely, and we should never make moms feel shamed to do what, first of all, their bodies were made to do and what their babies were born to do, and knowing that it's something that benefits baby, mom, and the health of society, it's something we should really be supporting.
Okay, so what happens if a mom is at a public area, wherever it is, and she is going about breastfeeding her baby, and somebody says, I'm sorry, ma'am, but you'll have to leave, or they make an issue? What happens then? Do you step in and help her?
We have done that before, yes.
Okay.
And first, I would just really encourage moms to just try to learn what their rights are, and that, hey, I can be here, I can nurse my baby's hungry, and they need to eat just as much as all of us.
Okay, so reiterating that once again, you said it is a federal and state law that gives them the right to do that.
Yes, yes. And so you are entirely protected anywhere, anytime you want. And so we try, of course, in our education efforts to let moms know that as much as we can. And for the times that things happen, we are there to support. So we'll make a call to the employer or the corporate office, as it may be, and just let them know that some more training is needed for their employees. And typically it's just the one-off employee who didn't know, or and they just they just didn't know.
So if employers need training on this, can they call you to come in to do that? Okay.
Yep, we do have a Breastfeeding for Businesses program, and so it's actually designed to let employers know what their what their employees' rights are, first of all, and what their customers' rights are, but also how they can help support their own employees and customers.
Well, I guess like in any other situation, if both parties are sensitive to the other person's point of view, you can find a way. You can find a middle ground.
Yeah, and it's just all about education. And when people know, they know the benefits, they're just much more open-minded about it, and they don't have to fight about it.
Exactly. Then you can just come to a compromise there. Okay. What other laws are going on? You did talk about like family law and family leave. What's happening with that?
So this year,
and it's paid family leave.
Yes. So at a state level, we worked on a paid family leave bill, and also at a federal level, Senator Schatz was working on the Family Act, which was paid family leave for the nation.
Okay.
It's going to be something that we're going to have to work on again next year, because unfortunately, it's kind of stalled out in the legislature this year.
What exactly is that act? What does it say? What does it cover?
Yeah. So for Hawaii's paid family leave, what it would cover is employees that are covered under FMLA laws would be entitled to 6 weeks of paid leave, partial wage replacement from their job. So that would cover moms and dads, both moms and dads, which is important to note. And it would also cover anyone under FMLA. So if you have a spouse, a parent, anyone who may have critical illness or something that you need to tend to them, you don't have to worry about choosing between your job and your family. You can take the leave and be able to receive some wages.
Oh, okay. How long is the leave for?
It was proposed for 6 weeks, and again, we'll have to be working on it next year, but what's also important to note is that it's employee funded 100%. So in the same way that we contribute to our state's temporary disability insurance, this would be a temporary caregivers insurance fund, and a few cents out of every paycheck would go towards this fund, and it would be maintained parallel to our TDI system, and when it is fully financially stable, then people can begin to withdraw from it.
That's good to know. It's like that is your right because you paid for it.
Exactly. And everyone should be entitled to take from it.
Now, what happens if, say, in a family, mom and dad, but they're not living together? Does the other party that's not living with the family still qualify for that?
Yeah, that's an interesting question, and I would think so. I mean, when you're talking about both parents, even if they're not in the same household, they both have equal responsibility to care for the child, and so that should be something that would be covered. Yes.
Interesting. So what happens when you go down, like you mentioned that it's something you have to bring up next year. When you go down to the legislature, do you have, are you there actually lobbying and trying to get those bills heard? And
yes. Yes, and that's actually something that we work really hard through HMHB, is to talk to our moms and our, our friends on our social media and stuff like that, to get them engaged and informed about what's going on. Because so many things happen at this level that we don't hear about or know about unless people are kind of serving as a conduit for us.
So it's very good for them to share their different situations with you, so you know what's happening out there.
Yes, absolutely. And we had pages of people writing to us telling us how paid family leave would impact them and their families, how they wanted to spend time bonding with their baby, but they couldn't. They had to go back to work. Hawaii is an expensive place to live.
It is,
but unpaid leave most of the time.
Right. So what happens if they take the 6 weeks and they need more? Are they entitled to have more, or is that something now that falls into their own like vacation time?
I think we would need to look at what's all included under FMLA, and FMLA does include more unpaid leave for families, so I think there would probably be that kind of gap option where your job is still protected, but you might not necessarily be getting the wage replacement. And for situations where, if for example if you've had a C-section under our state disability, you receive 8 weeks of TDI. So in that kind of situation, it would be a little bit longer than
you can combine the two, the family leave and the TDI. Okay. Wow, what else is happening in the legislature? They must be so exciting when you get down there.
I really enjoy it, because it feels like you're actually making an impact for people.
You're very passionate about what you're doing. Thank goodness that you're the executive director with it. Wow.
Another bill that we have this year is actually, it's fairly innocuous, but breastfeeding exemption, a jury duty exemption for breastfeeding women. So if you're serving on you've been called for jury duty, and you have a child who's under age 1, then you can opt to receive a completely, painless, exemption to your duty that time. For the same reason that someone might have a medical exemption or anything else, it's not saying you're not going to come back and serve jury duty. It's just not during that really critical time for you.
So does that require a note from a doctor, or what, is it just a statement from the mom?
Yeah, so it would be kind of just another checkbox on the form.
Do you have to bring the baby to show them that? Do you have to provide proof?
We have kind of built in so that the judge can ask for a doctor's note or some kind of proof, and so your doctor could say, yes, this woman is a breastfeeding mom, and that would be good enough for the judge.
Because you never know how long the trials are ever going to last.
Right, and needing a break to pump so that you can maintain your milk supply you can't stop a trial for that. So.
Wow, that's interesting. Thank you so much for what you're doing.
Oh, absolutely. You're welcome.
Gosh. So, okay. What other, I'm trying to think, I know there's a lot of mothers' rights out there that so many moms and my friends don't know about. So we touched on breastfeeding, we touched on the safeties, we touched on the family leave. Are there other issues out there that you think commonly a family or a parent would want to know?
Yeah, healthy nutrition is a really important one, and getting healthy even before you get pregnant is something that people don't know about, because over half of pregnancies are actually unintended or unexpected. And so sometimes it's just too late after you've already found out, and if you haven't already been maintaining a healthy lifestyle and taking care of yourself, you've really lost a critical window in the very early stages of development.
Now, is there any legislation or law that addresses that for a woman that just found out she's pregnant and maybe needs some extra, I don't know, time to get healthy or whatever? Is there any laws that protect her with that?
I mean, the one thing that comes to mind is WIC, which is Women, Infant, Children. And that for income qualified women, and there's a higher than normal threshold for pregnant moms. That entitles you to get food subsidies, which are really ideally designed for a pregnant and a nursing mom.
So they may not have all the income they need to get the milk and vegetables or everything that they need for that.
So you might not qualify for SNAP or something like that, food stamps benefits, but for WIC, it's a different threshold, and so a lot of people qualify who aren't surprised. Even a lot of military dependents are qualified for WIC, which is very surprising.
That is surprising, because you think that they're receiving all the subsidy from the military, that would be enough, and being able to shop at the commissary and everything. But so how does a person that may be watching say, oh, okay, my daughter may qualify for that, or I may qualify for that. How do they go about doing that?
Yeah, they can always contact us, and we can refer them to the appropriate local agency for them. Otherwise, there's local WIC offices all throughout the state, and they can help you out.
Okay. So again, for the public, have them just keep talking with you, keep letting you know what's going on, because that is the information you need when you get down to the Capitol.
Yes.
And you're standing there saying, we have been told, by 500 plus people.
Yes. I mean, and legislators need to know too. I mean, they care and they want to know what's going on with their constituents. And so when we can tell them, hey, we have these men, this many women are telling us that this is a problem, or this is what they care about, and we can hand that to them, that makes a difference for their decision making.
Now, do there have to be, do establishments or businesses have to post any type of notification regarding the legislation for women, breastfeeding moms? Do they have to post it in their lunchrooms or anywhere?
Employers with 20 or more employees do need to post something, and that pertains to their employees and their employees' rights to pump at work. As far as notice saying that a woman has a right to be breastfeeding, there's not a requirement to post that, but again, we just are reaching out to businesses so that they know that, and reaching out to women so that they can be equally informed. We have a little printable card on our website that they can download and print that shows this.
They can just carry it with them.
Yeah, exactly.
Oh, then they don't have to remember all the numbers and everything that go with it. Now, here in Hawaii, many times we're not connected or really anchored physically to the corporation, and they have branch offices. Say the branch offices, you said 20 or more. Say a branch office has 5. How does that work? Do they not qualify because they only have 5?
Yeah, as long as the employer, the umbrella corporation, has 20 or more employees, then no matter how many their individual branch location has, they would qualify.
They fall under that umbrella.
Yes.
Okay. Okay. Wow. This is just amazing. I mean, I know we could go on and on. We have about a minute left. Is there anything else, Lisa, that you want to get out to the public regarding, healthy babies, healthy moms? And
yeah, the only other thing I would really love people to know about is our program called Text for Baby, and it's a text message resource that every week of pregnancy up through baby's first year of life, it's a free health text messaging resource, and it sends you up to 3 messages a week about developmental information and what you need to know that week.
And is it interactive where they can text back and forth with you?
They can. Sometimes
it's a text hotline, basically.
Yeah, and it's somewhat limited, and most of the messages are just a one-way interface. However, sometimes they'll ask questions such as, do you have health insurance? If they say no, then it'll respond.
They'll know how to send out
specific information.
Got it. Thank you so much, Lisa Kimura with Healthy Mothers, Healthy Babies Coalition of Hawaii. Please send your comments to TBN, P.O. Box A, Santa Ana, California, 92711. You may also reach us at www.tbn.org. Have a wonderful day.